Hi, everyone. My name is Dr. Purvi Patel. I have Dr. Kaplan with me today. For those of you that are new to my channel, my name is Dr. Purvi Patel. I'm a board certified family practitioner and a board certified geriatrician. And I have with me Dr. Kaplan. She's a colleague that I turn to for all my questions. And she is also a board certified internist as well as a board certified geriatrician. And today she will talk to me a little bit about what geriatrics is and why she chose geriatrics, as well as importance of exercise to our older patients. So thank you for talking to me today, Dr. Kaplan. So tell me a little bit about, how exercise is important for our patients.
So,
How often should they be exercising?
so many years ago, I remember sort of learning a concept that was not familiar to me, sort of something that's called an exercise prescription. I just sort of thought, people do exercise. I didn't realize that there was sort of ways of doing it. And in learning a little bit more, just the physical aspect of exercise, I've learned to appreciate it more and to understand it better. But I think when we think about aging, we sort of tend to think in two major categories. One is sort of just like our mental health. Will we be able to manage the world through kind of our cognitive perceptions, and also being able to navigate the world through like physical function, walking, being able to do things. In the big picture, many of us don't think of those two things separately because we think that they're integral to just having a good quality of life. And it's easy for us to understand how better physical health through exercise can translate into just being more fit as we age. That's not hard to understand, and I think that's probably a big reason why exercise is so important. But I think over the years we have learned to understand that the mind and body are not really separate. We know that we tend to think of it as separate, but it's not. Everything that's good for our heart, our kidneys, our muscles is also good for our brain, and that the data, sort of more specifically, studies that have been coming out to sort of prove that point, which really should not have been something that would have been a far stretch for us to understand. So that's why I think it's important.
Okay. And do you think exercise also helps with brain health? I mean, with all the blood rushing to the brain after we exercise?
So absolutely, I think that there's sort of two parts to this. So the cognitive piece, like how our brain is working, um, is important, and that is improved with better blood vessel conditioning. So that is the whole reason for exercise, sort of aerobic capacity and blood flow. And then the other benefits of exercise are the ones that sort of athletes know very well about, sort of this whole feeling more content, in control. Depression, anxiety could be very well controlled through exercise.
Should there be strength training as well when we talk about exercise for our older patients? Should they be using, a little bit of weight or even just free body weight as opposed to like using 1 or 2 pound weights or, a can of beans, for example, just to kind of strengthen the muscles?
So Purvi is referring to this is kind of the whole concept of an exercise prescription, that any exercise, if you're not doing anything, is important. So if you're not doing anything, do something. But if you're going to do something, there's a way of doing it to get the maximum benefit. So we think of exercise as sort of in three components generally, sort of the aerobic exercise, strength building exercise, and flexibility.
Correct.
So when we talk about an exercise prescription, it should incorporate all of those. Um, Aerobic exercise is important because it sort of gives you this whole kind of oxygen capacity, but it cannot be done alone without strength building. So this is kind of like weights, isometric strength building, building stronger muscles in your legs, in your arms, in your back. It's good for bone strength because that kind of um, weight stress is what stimulates bone growth and repair. And flexibility, as you know, would be important for being able to do things comfortably. How many of people that we know have issues with stiffness and not being able to turn a certain way? So exercise has to incorporate all of those factors if you want to do it right.
Right. And so, I mean, so are you saying endurance should be maybe 10 minutes a day? Is there a certain time, or should it be more of what they can tolerate per day? You know, whether it's walking or repetitions of like arm circles and stuff like that.
So in general, probably about if you sort of look at time that you exercise as something that's 100%, probably about 50% of that can be spent on aerobic exercise. Would be just something that would get your heart rate up a little bit, and then probably another 30% would be spent on strength building and 20% on flexibility. So something like that would probably be a good balance. So if you had 30 minutes of exercise a day, you would probably spend about 15 minutes of that maybe doing some activity that would get your heart rate up, just maybe walking, and then maybe spend about another 15 minutes on strength exercises like doing arm or legs, and another 5 minutes doing some sort of a flexibility exercise.
Okay,
So
and that sounds good. And so, how does exercise? I mean, and I've read a lot, and of course, we both know a lot about how exercises helps our mood as well. Does exercise improve and enhance mood, anxiety, depression? Let's say.
I yes, I think everybody knows that from personal experience. The endorphins that are released as part of
Mm-hmm.
exercise are important. I think in general, everybody who starts an exercise program tells you that they feel better. And there's certainly a lot of data for athletes that is important. I think also as people get older and they have less regimented routines. So when we are younger, many of us are working, we have these schedules that help keep us organized. Having activities on a daily basis like exercise also gives the day structure and organization, and is helpful just from that perspective. So I think mood and anxiety, lots of data on that. I don't have the specifics, but we know it's a chemical reaction. It's not just that somehow, because you look better all of a sudden or your muscles are stronger, but it is a chemical reaction, sort of chemicals that are produced by our bodies that cause improvement in our mood.
Absolutely, absolutely. And so that's great, you know, for anyone that needs some inspiration to get moving. Any movement helps. And also, not just that, we see in our practice, we see a lot of pain as well. You know, exercise, does exercise help pain by improving their mood, let's say, or the anxiety and the depression? Does that?
Yeah, I don't think, yes, absolutely. I don't think that we know exactly which component is the most important, but we certainly have, as clinicians, we are all aware of this because we know that people with depression tend to have more chronic pain. People with conditions like fibromyalgia tend to have more, sort of be worse off when they're not exercising than when they are. One of the treatments for conditions like fibromyalgia is exercise because we don't have specific medicines that address the whatever the biochemical physiologic changes are. But we know that in studies, when people exercise, they tend to feel better and do better. So absolutely, I think there's lots of evidence that exercise can be helpful with chronic pain, be it through just making your muscles more conditioned or being through mood changes.
Very good. And then I know earlier we talked a little bit about bone health and how it relates to exercise. Should a person consider let's say in their 40s and 50s, should they consider supplementation with calcium and vitamin D, or would that be more of a per person basis and exercise is simply just good for bone health, and if they choose to supplement they can, or and decide on
Yeah.
their end?
I think that every time we've done a study on supplements, we know that giving people extra supplements does not fix anything. If people are deficient, that's one situation. So if you're vitamin D deficient, that is a situation. And certainly if you've had a fracture, you would be evaluated for it. But just giving people vitamin D does not appear to be fixing anything. Um, we have much better data that weight bearing exercise does actually treat and
Right.
improve osteoporosis. This is not something that is just something that we think will work. We know that it does. And so we know that bone health is something that we deal a lot with in geriatrics. We know that falls and fractures are main determinants of mortality as people get older. You fall and then you can't walk, and most likely your life expectancy has been greatly shortened after that. But
So yeah, well, and essentially, I mean, exercise also, it improves life expectancy. I would think it reverses a little bit, if not fully, cognitive impairment, if you will. And so, do you want to tell us a little bit about that? How we think, and is it because it kind of improves their overall health, or do we think it's more just something that we're doing? It's like a total reaction in the body.
yeah, so I think we see a lot of people in the office that uh, think they are having cognitive decline. They're feeling forgetful, but do not necessarily have dementia. We talk about what sort of lifestyle changes would be helpful to try to stall or reverse some of those processes. And we talk about physical and cognitive exercise. So, our brain is a muscle, it needs to be exercised. It exercises by working through new problems, by talking, by socializing, all of the functions that are integral to that muscle, just like the same way our arms, lift and kind of hold things. So, we have to do both. And part of that is also making sure that the brain is well fed through good blood supply. And that's sort of just the general effect of exercise. But exercise of muscles alone is not enough to exercise the brain.
Perfect. Well, thank you so much. And so tell me a little bit about, what is geriatrics? People talk about, neurology. People talk about psychiatry. We don't hear a lot about geriatrics. And we're both geriatricians. And I want everyone to know what we provide for the patients, as opposed to neurology or psychiatry or a general internist.
So, geriatricians are, doctors of older people. Generally, that age has been moving up. We're talking about sort of more people now that are kind of advanced age, probably over the age of 75. But it is somebody who specializes in the care of the elderly, better understands chronic conditions that affect those persons, and kind of manages their general health. It is in many ways kind of primary care, but for an older person. I think many of us probably don't have much problems distinguishing like a family doctor and a pediatrician, but sometimes we may have sort of not quite understand that distinction between primary care and geriatrician. So we solely focus on the care of those older folks, and don't really sort of um, manage other ages of patients. So that's kind of where our niche are, and the conditions that affect those older persons are the ones that we know more about. We work with all other specialists. We work with neurologists, and a lot of times, just like with family doctors, there may be conditions that both doctors can treat and kind of help each other. And sometimes some conditions may require, or symptoms may require further evaluations by a neurologist because they may not be so straightforward, but we are generally aware of that and work together with other specialists. Does that answer?
Yes, yes. I think that kind of clears up what we do in geriatrics. I think so. We've learned a lot of great things today. Just to sum it up, how exercise is important for brain health, and what are some of the exercises that we can do at home on our own for our older patients, even the younger ones. I think, it starts cognitive health starts changing perhaps in the 40s, 50s, and it more manifests itself in the 60s and 70s. But it's never too late to start exercising. It's never too early and never too late. And that's what we have for today, guys. For more information, please like and subscribe and comment to the video, and I will keep bringing you more.